this is a big day for you guys because I've got 2 interviews in one day. I've got Dr. Jason Fauntleroy from Rebel Med in Seattle, which is my favorite name for a practice that I've ever heard. So welcome, Dr. Jason. It's so great to have you here. Is that okay if I call you Dr. Jason?
Absolutely. Cool? I love it.
You're flexible. Well, so what we wanted to talk about, everybody, was how sometimes we will get sick, people will get sick with mystery illnesses. And so today is dedicated to mystery illnesses. And I think falling under that category is stuff like mold, right? Mm-hmm. Mold and biotoxins. Lyme falls in there too. So we're going to impart a little bit of our knowledge about how we might help people who haven't been exposed to mold, have been exposed to these kind of things. And so try and give you some practical tips. So Jason, you're down in Seattle and people can reach out to you. What's your website?
Yeah, you can go to rebelmednw.com. That's for Northwest.
All
and
right.
You can look us up and be a rebel if you'd like.
Be a rebel. All right. All his patients are rebels. I love that. I mean, that's so fun. So we've been having a conversation, you guys, about mold toxicity and how you go through this. And Dr. Jason has worked with people in a previous practice, sort of working through the Shoemaker protocol. And now that he's in his own practice, you graduated from Bastyr a few years ago, right?
Yeah. Yes.
Bastyr is the amazing naturopathic university in the United States. It's the premier one. It's the place to go to naturopathy school. And I'm so honored to have you here. I'm a wannabe naturopath, right? So, and so tell us a little bit about how it differs from allopathic. When somebody goes to a naturopath, what are they thinking about?
Yes, fantastic question. I get this every day, what makes you different? And it's going to be different state to state on what our credentials are. But here in Washington, it's really nice. I act as a primary care pretty much in every way, just with difference in philosophy. So I can still prescribe, I can still order imaging, do those things that are necessary. But then I like to think of it more of a preventative perspective, or how can we help come up with options? So sometimes people they're really having side effects from medications and they're like, hey, do you have something that's less intense? Or, so we have herbal options, we have nutraceuticals, supplements, or even sometimes just diet, lifestyle, counseling, spiritual help. We have acupuncturists at our clinic that are fantastic. I use them myself, so.
Oh, yay.
Just allowing us to have a diversity of concepts. So there's a time and a place for penicillin, and then there's also sometimes other options. And what can we do to help you make that choice that's best fit for you and your desires? So
I love that. Well, and I like the way that naturopaths talk about really caring for the terrain, right? If you make fertile soil, you can grow a beautiful garden. And if we care for the terrain of our body, we really can usher in amazing health by each person figuring out what works for them. And I love that individualized approach. It's pretty neat that I wish that I had an office where I could walk into an acupuncturist's office and say, hey, can you help me here? That's really neat.
It's a wonderful privilege to have that access. Absolutely.
Yeah, well, so Dr. Jason came to me with a few questions, and so I think that maybe this is great. You can ask me. Why don't you ask me a few questions about the whole mold challenge, right? And then you could do a little interviewing of me, and then we'll back and forth a little bit. How's that sound?
Great, fantastic.
Okay.
Yeah, I'm coming to you specific because I have a few patients who kind of come in with really non-specific complaints, but nobody's been able to figure out what's happening, chronic sinus problems and, brain fog and, these things that are hard to really pin down and diagnose. And so they come to me and they say, hey, I live in Washington. I heard mold can be bad for you and mold's everywhere here. The approach to that is a little bit complicated. And I would love to see what your perspective is on how you kind of address that kind of non-specific complaint.
Right. Oh, gosh, this is so important because this is something I experienced myself. I had lots and lots of unusual symptoms that didn't seem to follow any pattern. And I had a naturopath tell me that that I was sick from mold. And that was part of my journey. And I'm so thankful, we have blessings that come in strange ways, but having that happen and then being open to, could that really be? Because in medical school, they did not talk about it at all, right? It's and being open to the possibility and then diving deep to figure out what I would do and trying to get myself better. So what we would first want to say is that not all mold is toxic, right? We do live in the Pacific Northwest, and a lot of the mold is just, it's part of the woods and it doesn't make you sick. Okay. Now, when mold is in a building, many times that can be different. And there are ways, and some molds in buildings are more toxic than others, but in general, we want our interior environment to not have mold in it, to be dry and sealed. So that's sort of what we're looking for, dry and sealed in terms of our living environment. And you can check your place, you guys. There's different ways to check. Not all mold inspectors know how to figure out if you have a problem. If you have lots of symptoms, okay, let's kind of go down. I should make a song about all the symptoms, right? So the potential symptoms from mold, you mentioned sinuses. So mystery sinus problems that never improve certainly can be a thing. But starting at the very top, people can have headaches. They can have brain fog. They actually can have memory problems. In fact, there's a really interesting paper where mold toxicity was called inhalational Alzheimer's. Interesting, because because it really can cause memory problems. That was part of my manifesting of the thing, is that I couldn't remember a darn thing. I had my nurse who I walk out of a room and I say, who did I just see? Thank goodness for a wonderful nurse. I mean, yeah. So brain problems, fog, ring in the ears, issues with the sinuses, problems with your vision, in specific visual contrast sensitivity can be off. That means you can't see gray from white as well. People can have red eyes, goopy eyes. They can have issues with swallowing and hoarseness. They can have asthma that does not clear with normal inhalers, right? If you have tricky asthma, like, why isn't the asthma getting better? Breathing problems, cough, shortness of breath, exercise intolerance. And, unfortunately, these people get what I call medically gaslit. They'll have a normal CBC and a normal CMP, and they'll be told, you just need to exercise more, when they're really sick. They can have problems with their gut. It could be tummy pain, weird, sharp, shooty pains all over their body, joint pains, muscle weakness, problems with peeing all the time, like always in the bathroom, because water just runs through them because they can't concentrate their urine as well. And they can have big swings in their stress hormones, abnormalities in their sex hormones. So truly, it can be a full body. I know that was almost like I'm sorry for the litany, but it can cause a lot of problems. So I had a lot of those things myself. And then I discovered that there are ways to treat it. And when you want to figure out if it's your issue, guys, the first thing that you want to do is look for someone who has a little bit of experience with mold illness. And there are the International Society for Environmentally Acquired Illness, ICI, is one of those that you can look for to find somebody that knows about this. You can look on a place called Surviving Mold. So you're finding a practitioner who can walk arm in arm with you, right? Because it's not commonly known. And then we want to look at the place where we're spending time, right? Look at our home, look at our workspace. Is there water damage? Because water damage, behind water damage, you see the stains on the ceiling. Behind that, there really might be something lurking that's making you sick. Okay. So we want to investigate. And if you find mold, don't put bleach on it, everybody. Right. So bleach on mold will release spores. We, if it's in the bathroom, you can use vinegar and water solution, right? Mechanically remove it. But the thing about mold is mold begets more mold. So we want to control problems as soon as possible preferably by removing any stuff, removing it, bagging it carefully, and getting somebody that really knows how to do it. So there's tests that you can use though in your body to see if you're dealing with mold. And there are a couple different categories. One is measuring mycotoxins coming out in urine. So Dr. Jason, have you guys used this at all, urine mycotoxin testing in your practice?
We have a little bit. I'm still new to it, so you probably have more experience with it, but yeah, absolutely. That's one of my favorites so far.
Yeah, well, and what this does, everybody, is it gives you an idea of the flavors of mycotoxins that are coming out.
Flavors, I love it.
Yeah, right. And it can help you guide choice, because the first thing we want to do is help facilitate your body removing them. And the way we do that is with natural and sometimes prescription binders that we take, and that helps pull it out in the stool, right? So we start to move it out that way. So you can't be constipated. That's really important, right? Once you've identified that you have the issue. Now, sometimes people will have a near normal urine mycotoxin test, okay? And they look like they have mold toxicity because they check all the boxes. That can be one of two things. It can be that they really are holding on to every bit that's coming into the system, or they have a different kind of biotoxin illness, probably Lyme disease, okay? Or tick-borne illness. But you still want to try, if somebody has a mold exposure and looks like they have, clinically they have the picture, you want to try using binders and then recheck the urine mycotoxin test and see if you start to pull things out, if things start to pour out of them, right? The biggest thing that I see, Dr. Jason, is that people who have heard of Lyme and understand that Lyme has all those symptoms too. So all the symptoms I just listed, you guys, can be symptoms of Lyme disease. And they're aware of Lyme, but not aware of mold. Mold is probably more common.
Sure.
Yeah, because of the percentage, half of all buildings probably have water damage in them. So what we want to do is see what's coming out of your body and then match some binders that can help you begin to move it out, right? And the other thing is testing the home. Mm-hmm. Have you ever had your place checked, Dr. Jason, to look for anything like that?
I never have done mine, but I've worked with patients to help find the right person to do the testing. So
yeah. Because you want to find the right person, because some people, especially people who come to it from construction, they're really construction minded and not really thinking about the illness part of it. So I think ICI, that group, has a nice reference list. So if you don't have to be a member of ICI to go and find somebody that's been kind of approved and understands about mold illness, and they'll give you a list of names of people who could help you look at your place, because just doing an air sample in somebody who's sick, it's inadequate. And there's different ways to test. I'm not an expert in testing. That's why I get somebody else to do it. An ERMI, a lot of people read about ERMIs, right? Environmental Relative Moldiness Index, and that has its place. But the first thing is, if you have water damage, you focus on what you see, right? And so, and I wouldn't ever do an ERMI test if I could see clear water damage. I'm like, there it is. Yeah. Whoop, God. So you got to take care of what you see. Mm-hmm. So let's see. And I think so finding somebody who can check your house, somebody who can check you, is really important. And then Jason and I want to give a message of hope, because this is something people can improve from. And even if nothing else has worked, there's one thing that is very helpful for folks, even before they see Dr. Jason or see myself, and that's to try and help the brain. I just did a great interview. Y'all should check out this interview with Dr. Marla about neurofeedback training. And she found that was a key to unlocking her healing before she did all of this other work. That and Annie Hopper, DNRS, Dynamic Neural Retraining Systems, and also the GUPTA program. Those are neat ways that we can start to bring down our level of sensitivity. Which reminds me, we really haven't talked about MCAS very much. Yeah, we should touch on that. Yeah, so many people with, I imagine you've experienced this, the hypersensitivity, like to smells, to foods, they start to whittle away what they can eat and start to stay in their homes because they're so sensitive. Have you experienced that in your practice some, Dr. Jason?
Absolutely. I'm seeing it more and more recently. So I don't know what's in the air.
Yeah, well, yeah, I mean, I think that having a strategy, and this is something that people can probably say, always anything that I'm suggesting, please talk to your doctor about, but there are some natural supplements that can help with that sensitivity, and the brain training can also help with the sensitivity. But as a place to start, I really like starting with quercetin. Quercetin is such a great, I mean, if we could put it in the water, I think it'd be good, but it really helps. I remember back in medical school, the cardiologist was saying he wanted to put statins in the water. Thank goodness that didn't happen. But I think that quercetin is something that can be very useful when people are hypersensitive. And in the protocol that we will commonly use to try and help people start to bring it down so that they can take treatment, which is the binders, would be quercetin, 250 to 500. Sometimes you have to start super slow, even with a pinch. You work up to doing that, 3 to 4 times a day. And if you work your way up slowly on quercetin, most people are then, if they weren't able to tolerate binders before, they start to be able to tolerate binders. And then, we even use some conventional meds there with that, like, Claritin, because it also helps reduce the sensitivity, reduce the histamine response. I sometimes use Paramine, and Miraca is another one that I find helpful. Because if somebody is super sensitive, you have to address that before you can move forward with the treatment. Yeah.
That's a good point. I love that. And quercetin is one of my favorite mast cell stabilizers that we have out there. Yeah. Good.
So, yeah. So the with mast cell activation syndrome, you guys might have heard of MCAS. That's very common with this kind of issue with like biotoxin illness, Lyme, and mold illness. And if we can start to, and mast cells, they're like balloons of histamine. And so what happens is the mast cells are cruising around in your body and they are neurally triggered. So even a thought can trigger release of histamine, right? So that's why it's so important to get the brain involved. And the mast cell stabilizers help keep the balloons together, right? Instead of them going, wee, with all this histamine. I had somebody, one of my first patients that had mast cell activation syndrome. She came to me right after an emergency room visit because she ate something that released a lot of histamine, because foods can release histamine, you guys. And she ended up in the emergency room because she had chest pain, which was actually from histamine being released in her esophagus. We always want to get chest pain checked out, but when everything is normal, then you got to wonder, could you be having a reaction that's related to histamine? Because it can look like allergies, it can look like chest pain, it can look like abdominal pain, because that causes swelling where it's released. I'm so glad you brought up about MCAS. Yeah. Let's see, any other things that would be important for us to share with people today that can help them? We can recap our points.
Great, let's do it.
Yeah, okay, so recapping points. Find a doctor that knows a little bit about this, okay? Find somebody to look at your place that knows a little bit about this too, okay? A great place to begin is with the brain, trying to help get the link between brain and body going to decrease sensitivity. So that would be Annie Hopper DNRS, or the Gupta program, or neurofeedback. If you're super sensitive, you want to calm down, calm down that sensitivity with maybe some supplements. What Dr. Jason and I might use first would be quercetin. Then I tend to add Claritin because it's pretty well tolerated, but you want to get so your body's not triggering immediately. And then binders. So if you work with your, if you work down, if you're a rebel and you work with rebel med, you might get a urine mycotoxin test. And then Dr. Jason would tell you, well, these are the flavors of mycotoxins that you have, and here's the binders that will fit for you. Now, there's more advanced ways, and Dr. Jason knows about these, that we deal with people who don't get well with just binders, and that's something that you want to talk with your doctor about. But sometimes we'll use treatment in the sinuses and treatment in the gut that can make a big difference. And yeah, thank you so much for joining me. And we're going to have to do this again sometime soon, I think.
Great. I would love it. And I'll give you a pro tip on histamine. One thing that I found for diet is that oftentimes we get leftovers will release a lot more histamine. So if you are sensitive to your leftovers, watch out for that increase in histamine. And that's a good way to kind of gauge whether or not you have a histamine response.
I love that pro tip because, many people will say, I can't tell what's triggering. I know some food's causing this, but it seems like it shifts all the time, and they don't know about leftovers. The longer it sits, the more histamine is created by the food, and that can make it so it's hard to figure out. So Dr. Jason and I would both say, if you're very sensitive if you try a low histamine diet, you're going to be able to see if that's part of your issue. So it's one strategy. So thank you so much for joining me. What I'm going to do is I'm going to say goodbye to our streamers, but don't hang up, Dr. Jason. Okay. And thank you guys for joining us, and reach out to us with any questions.